Hey, it's Dr. Brian McKay. It's January 2nd, 2024. Happy New Year. Today, we're going to be weighing in with Wegovy. Yes, Wegovy. So, what you're probably wondering is, what in God's name is Wegovy? Well, if you're looking to lose weight, chances are you heard about Wegovy and Ozempic. These are called GLP-1. And what is a GLP-1? GLP-1 is a glucagon-like peptide, number one. And what's a peptide? Peptide is a bunch of amino acids, which are molecules that are linked together by a peptide bond. And it kind of like a combination lock of different to build proteins. And it's kind of a complicated thing to explain, especially in a podcast. But the main thing, when you buy Wegovy or Ozempic, it's the GLP-1. And the GLP-1 has many different things. And honestly, I think it's, personally, if it can help you lose weight, I don't think it's a bad thing. It's not a drug. It's sold and marketed as a drug by Big Pharma, but you can actually get these it's a naturally occurring substance. So let's dive into GLP-1. What it stands for is glucagon-like peptide number one. And what happens is it's a peptide hormone produced by the intestine, and it's in response to eating. Okay, you eat, and what does the GLP-1? It helps regulate blood sugar, and it has different effects on metabolism. So it's kind of let's touch on the benefits. Okay, so GLP-1, glucagon-like peptide number one, stimulates the release of insulin from the beta cells of the pancreas. Now, pancreas is where beta cells lie. Beta cells produce insulin. Insulin is one of the most important hormones, really. And what happens is insulin, if you haven't heard the topic, insulin resistance, you're going to hear the topic a lot more. You will hear it a lot more. What happens is there's too much sugar or glucose. Your liver can only store so much glucose. And after a while, it has to get pushed out of the body, and it gets pushed out as fat. So that's how you turn carbohydrates, aka which is a form of a sugar, get converted into fat. So if we have too much, liver can only store so much, so it goes into fat storage. Now, on a side note, we've mentioned intermittent fasting before on my Not Just a Chiropractor podcast. What happens is when you do intermittent fasting, you give a chance to spend down all the glucose stored in the liver, which then allows an empty tank so you can fill it up with more glucose during the course of the day, because the amount of glucose we get these days is off the charts. It contributes to many of the healthcare issues we're having as a result of the standard American diet, which is not good. Most people don't exercise enough, again, which is not good. So the intermittent fasting allows the liver to get a break, empty out the contents of the glucose, spending it down for basic maintenance instead of getting it converted into adipose tissue or fat. All right. So let's get back to the Wegovy, weighing in on Wegovy for January 2nd, 2024. Give away my age there. Okay, so GLP-1 stimulates the release of insulin from the pancreas, and that's, the beta cells in the pancreas make it. I'm repeating myself there, but what happens here is it lowers blood sugar levels in the bloodstream by allowing the uptake of glucose into the cells. But then the thing is, you don't want the cells getting too full of glucose. Kind of think of a fat cell. Now, the GLP-1 suppresses the release of another hormone produced by the pancreas called glucagon. So you notice the similarity. GLP stands for glucagon-like peptide. Glucagon raises blood sugar by promoting the release of glucose from the liver. But the GLP-1 suppresses glucagon. Our body's made up of a lot of these excitatory and inhibitory pathways. And this is one way of looking at the GLP-1 or the active ingredient in Wegovy or Ozempic. So you have one that facilitates the uptake of glucose into the cells, and you have one that raises, promotes the release of glucose from the liver. Added benefit here is with you have slowed gastric emptying. So the GLP-1, again, the glucagon-like peptide number 1, slows down the rate at which the stomach empties its contents into the intestine. So what happens is you feel like you're full, which is a pretty good thing. If you're full, you're going to eat less. It makes it a lot easier to walk away, shut the refrigerator door, keep it shut. And, people, I would imagine a lot of people are considering, right now they're signing up for the gym and they're probably looking to, get to see their primary care doctor to get a prescription when there is a shortage of this GLP-1s out there. So the other thing too is there's thoughts, it's not confirmed, but it's appetite regulation, that the GLP-1 reduce the appetite, the brain, and there's a center of the brain called the nucleus accumbens that is a reward center. And, it may satiate the nucleus accumbens that you're not wanting to eat more. And the other thing too is the beta cells we talked about earlier. Beta cells, the GLP-1 protects beta cells. It's kind of like a little army in there in your pancreas, helping, which it makes it easier for your pancreas to produce insulin. The more insulin you have to produce, the more you have insulin resistance. It's kind of like you're raising. It's kind of like let's use this as insulin resistance. You get two people screaming at each other. They keep screaming louder and louder. It gets worse and worse because no one's listening to each other. Well, the same thing happens with the body. If you have too much resistance to the insulin, you have to put more insulin in to have the same effect. Basically, at one point in time, it's going to wear out. It's kind of have implications for treatment of type 2 diabetes because type 2 diabetes, they start out where you can deal with insulin and can produce enough, but it gets to the point where you're no longer able to produce enough. That's type 2 diabetes. Another added benefit from the GLP-1 receptors are cardiovascular benefits. So you have a reduction in the risk of strokes and heart attack. So there's really, in addition to losing weight, so that's not so bad if you think about it. There's a lot of good coming out of it. Now, to break it down a little bit more, and I don't know if I'm getting into too much detail here, but a peptide is a short chain of amino acids linked together by peptide bonds, and they're basically building blocks for protein. When they join together the amino acid and the peptide bonds, they form peptides. Peptides are naturally occurring. Okay, they play a crucial role in biological symptoms in living organisms. You have peptides involved in hormones, which are signaling molecules in the body. Insulin is a hormone, glucagon are hormones, enzymes. So the amino acids as it relates to enzymes are biological catalysts that facilitate chemical reactions throughout the body. Antibodies. Antibodies are made up of peptides. So antibodies are a key component of the immune system. You got to consider all this. And that's where peptides is a really interesting area because right now there's big pharma's trying to get control of all the peptides, even though they're naturally occurring. And there's some finagling behind the scenes in order for them to control it. So it's one of those things that may not play out well because, you should be able to, they're not as expensive. They will be a lot more expensive and they're naturally occurring. So it's kind of like not a bad thing to get these. And we'll break it down a little bit later on about essential peptides versus non-essential. Essential are the ones that you need but cannot make, and non-essential are the ones you can just supplement with. But there are, so basically, we're looking for peptides in everything: hormones, enzymes, antibodies, neurotransmitters. See, you can't get away without it, okay? But going back to the little bit basic with the essential amino acids, those are the ones that cannot be made by the body. You have to get them through dietary supplementation or diet. Histidine, isoleucine, lysine, methionine, phenylalanine, tryptophan, valine. I'm missing one or two, but there's several. Not essential are the ones the body can make on their own. And these include arginine, asparagine, aspartic acid, cytosine, glutamine, glutamic acid, glycine, proline, serine, and tyrosine. So those are a little bit of the difference. But these amino acids linked together, you get peptide bonds that form peptide chains. So yes, I do believe that the Wegovy is going to help with weight loss, and that's another distinction. Is Wegovy is more for weight loss. If you have more than one comorbidity, say you're diabetic, and you're overweight. There you go. Say you're diabetic and you have hypertension. There's a whole slew of things that can go on, but that you're at more risk. Ozempic is typically to help treat, very much to help treat your diabetes. So it's diabetes for Ozempic, and they're both the same class. Okay, but it's definitely something you can want to consider, and you definitely want to check with your doctor to go ahead and do that. My name is Dr. Brian McKay, Core Health in Darien. I am looking forward to spending more time with you. Hopefully you enjoyed this podcast. Thanks very much, and Happy New Year.